welcome all the participants and resource person for the second session. Our today's second session is on pros and cons of top feeding. And speaker for that talk is Dr. Shilpy Gupta. Dr. Shilpy Gupta madam is presently working as assistant professor in the Department of Komarabritya, Government Ayurvedic College and Hospital, Patna, and completed BMS and MD from BHU, Varanasi. Ma'am has published more than 33 research papers in many national and international peer-reviewed index journals. And ma'am was the author for 3 books. Ma'am has participated in many CMEs webinars more than 300 times. Ma'am is awarded for many activities, social sports. With this, I will hand over the session to Dr. Shilpi ma'am. Please proceed with the presentation, ma'am.
Thank you, ma'am. And thank you, SBSJ PG Ayurvedic College for organizing this type of webinar on the occasion of World Breastfeeding Week 24. I greet all the participants present over here. Starting with the main core topic, pros and cons of top feeding, we'll go to the history. All this started early back in 1992 with the formation of WABA, that is World Alliance for Breastfeeding Action. It consists of a group of peoples who envisions the idea to oppose the strategy of promoting, supporting, and protection of breastfeeding. Later, in 2016, the WABA aligned its campaign with United Nations Sustainable Development Goal. In the same year, 2016, in our country, our Prime Minister, Shri Narendra Modi ji, initiated a campaign, MAA, Mother's Absolute Affection, for intensifying the breastfeeding policies. 24th theme for breastfeeding celebration to celebrate the breastfeeding week is to fill the gap between the feeders, the breastfeeders, and the non-breastfeeders. And the supports includes the individual support, the support from community, society, and to recognize those mothers who are ensuring the breastfeeding to their babies. According to the Convention of Right of Child, each and every infant has right to good nutrition. This is the right, but still undernutrition prevails. It is prevailing in almost 45 to 50% of our children. And seeing a data from 2015 to 2020, only about 44% of the infants from 0 to 6 year age are exclusively fed. And we are behind the policy, global policy for the breastfeeding 2025, that is to increase the rate up to at least 50%. Seeing the target for 2030, not only the initiation of breastfeeding feeding in the starting hour, and also to prolong it up to 2 years, in all the domains, we are lagging. We all know about the benefits of breastfeeding. Breast milk is not only a nectar full with love of mother, it is also beneficial for mother and to the society. The benefits of breastfeeding, as told previously by Dr. Ajay Sood sir, it encompasses infant nutrition needs, create maternal bonding with the baby, good for maternal health. But when we will see the formula feed, it only imitates the breast milk composition. And surely you will see the breast milk and the formula feed looks like this. This is the difference between the breastfeed and the formula feed. The formula feed is only imitating the composition of breast milk. The functional components are lacking in formula feed. We are talking about the trough feeding. Trough feeding is any milk or any substitute other than the breast milk. And top-up feeds are when some formula feed is given along with the breast milk. Undisputedly, Again, I'm emphasizing that breastfeeding is the best way the nature has provided to each and every infant. According to an infant survey, India is ranking 79 out of 98. In total 98 countries, we are ranking 79, and it is very behind. The initiation of breastfeeding had remained static between the 5 years of period. The reason of choosing the formula milk may be maternal factor or infant factor. It may be the lack of support, the concern about the maternal and child health, maybe the insufficiency of breast milk or any milk pumping disorder, maybe any pharmacotherapy. But there exists no any absolute contraindication for breastfeeding, not even in the HIV patient. Once the ART therapies had been started, the mother can feed the baby her breast milk, and only in some developed countries the breastfeeding is banned in the HIV patients. The hindrance in the breastfeeding may be infectious or transmissible disease, maybe the attitude of the mother returning to the work, she is not feeling convenient, so she chose for the formula feed. Maybe some inborn error of metabolism like galactosemia or any suckling difficulty, or very premature baby, insufficient milk is another cause, or multiple birth. Apart from these reasons, there are few determinants that decide the choice of the mother for infant to feed breast milk or not. This is taken from a qualitative survey, an observational study of year 2000, I think 18. It had observed that the knowledge and attitude, the socio-cultural context, and personal and professional support are the determinants of the choice of the mother to feed her baby or not, the breastfeed her baby or not. Again, it's not a direct reference. It had been taken about the milk allergy overdiagnosis. You can see the picture, the anxious mother, she is feeling that maybe her breast milk is defective. She is fearful of feeding a child, and she is exhausted. And the overdiagnosis of any disease, here particularly this is milk allergy, all these are imposing not to choose breastfeed for her infant. Again, according to baby-friendly initiative, whether the mother is choosing breastfeeding or formula feeding, if she is choosing not to breastfeed, then the healthcare professionals must support them for their choice. Again, UNICEF and WHO says the same thing. And always there exists a gap between idealism and realism. That's why the gap prevails. The difference of 44% feeders and 56% formula feeders, this is all because of the gap between this real scenario and the ideal scenario. As a consequence, the infant milk remains an important source for the nutrition. Talking about the pros and cons of tough feeding, it is seen that the breastfeeders are more self-regulated. It may be because they are early practicides of the coordination between the sucking and swallowing. Growth velocity. The growth velocity of breastfed children is less than that of formula fed. It seemed to be an advantage of the formula feeders, but you will see that in this paper, early feeding of large volume of formula milk is associated with greater body weight or overweight in the later infancy. There is a risk of overweight and obesity in such children. Also, the breast milk is optimal nutritional complex. It provides bioactive components with its functional benefits. These all are lacking in formula feeds. The milk manufacturer matches the composition of breast, that is formula feed, with the breast milk in terms of energy, calories, protein, but the functional benefits, the bioactive components are always lacking in formula feed. And this is one of the most important cons of tough feeding. The functional benefit, the bioactive components are like essential microbes, human milk oligosaccharides, immunoglobulins, lactoferrins, polyunsaturated fatty acids, etc. Again, these are the functional components. The breast milk is full of IgA, lactoferrins, different type of hormones, growth factors, enzymes. The manufacturers of formula feed one time or other always try to add on some of these components like the human colostrum. Sometimes they add the oligosaccharides, but all the components like breast milk is always lacking in formula feed. This is very important. The dynamicity in the composition. The composition of breast milk changes during the 3 stages of lactation. See the beauty of nature. The milk provided in the early days, that is 2 to 3 days, that it is colostrum. The amount is very less, but it is rich in protein, immunoglobulins. Then come the stage of transitional milk, is 2 to 5 days after the birth, and it is somewhat different. And then after a few weeks, the mature milk. The dynamicity of the breast milk composition, no one will match this dynamicity when the baby is top fed. Because once we made the formula feed with 1 scoop of powder and 30 ml of water or any other cow milk or any substitute like animal milk, the dynamicity is always lacking. Also, you will see the lactose content of breast milk varies over time according to the need of infant in starting 21 day. And after 21 day, it become constant. The lactose maintain the osmotic pressure and the mineral absorption, and it varies according to the need of the baby. The formula, again, the density of a milk fed at a time, the fore milk, the composition of the fore milk varies with that of the hind milk. The fore milk is very watery in consistency, and it is rich in protein and vitamins, and it firstly satisfies the baby's thirst, and the hind milk come later, which is slightly creamy in consistency, and it is dense in energy and satisfy the hunger of the baby. So also, the risk of disease. There is a higher risk of wide variety of health conditions in the formula fed or top fed babies. It includes middle ear infection, eczema, different type of skin allergy, GI infections, lower respiratory tract disease, asthma, diabetes, leukemia, and SIDS. In the top feed, there is possibility of contamination. We'll talk about the contamination occurred in the infant formula one time or other in the history. Here, it is an incident occurred in China in 2008. Melamine contaminated milk formula and its impact on children. This is published in year 2016, but the incidents occurred in China in year 2008. The melamine, the milk formula, the infant formula is contaminated with melamine, causing the health hazard to thousands of babies. Hundreds of babies, newborn babies are admitted, and 6 to 8, I think, died because of this contamination. Also, this is about the salmonella outbreak, and it occurred many times starting from 1995 in different countries. The outbreak, the Salmonella agona outbreak associated with infant milk formula. Again, a very deadly disease, a very deadly microbe, Enterobacter sakazaki. This outbreak is linked with the infant formula and has been reported to cause death in infants in the developed countries. One time and other, the Food and Drug Administration published warning against this infection in baby formulas. And there are several recalls from different countries like Asia, Europe, North America, South America for this ES contamination. As you know, the formula company the preparation, this infant formula comes with the three type of preparation. First is the powder formula, one is liquid formula that need to be reconstituted with the water, and third one is sterile milk formula that comes ready to use formula, and that one is only sterile. And other two, that is powdered formula and the that liquid formula, which need reconstitution or dilution with the water, are not sterile. So there always exists the chances of contamination. Powdered infant formula is not manufactured as a sterile preparation, and in a study of 141 formulations, 14% were found to contain that Enterobacter sakazaki infection. This is a research article from a journal, Food Microbiology, and it had shown the isolation of Enterobacter sakazaki and other enterobacteria from powdered infant formula and related product. This infection caused a very deadly disease, necrotizing enterocolitis, sepsis, and which may further go to meningitis, cause meningitis, and it is really a deadly disease in the neonates. This is a case of tampering of infant formula. It occurred in Canada with tampering of Nestle Good Start iron fortified infant formula cans. The cans were found tampered, and the formula, the infant formula powder, was mixed with something else, and that was not found suitable for the infant. This news flashed in the Hamilton Spectator in year 2010. The tampering of baby formula can prompt warning. So all these are the cons of top of feed, formula feed. Again, this is leaching of bisphenol A, a toxic chemical, from polycarbonate baby bottles into baby food, causing potential health issue. And this occurred very recently in year 2022. This toxic chemicals reached out from the baby bottles to the milk formula and had caused severe health hazard in the newborns. Apart from these allergic reactions, if a family is susceptible to any allergic reaction, the babies born in that family are also susceptible for the allergies. And you all know the formula, the protein used in the formula, the infant formula itself are derived from the animal proteins, like from the cow protein, goat protein, and there always exists a susceptibility to this milk protein to the infant. With the formula can be sensitized to cow's milk protein, resulting in allergic reaction. Risk of water contamination. The water used for preparing the infant formula may be contaminated, may be possibility of bacterial infection. If the water is used from the municipal water supply, it may be contaminated with fluoride. The mixing of fluoride may occur, which causes damage to the developing brain, and it is a well-known endocrine disruptor. It disrupts the thyroid function and may lead to a risk of bone cancer later in the life. Convenience. I had got this article from year 2016. Again, it is an observational study from a group of people from UK. They found the formula milk convenient. The convenience of formula, since any caregiver can help feed the baby as opposed to just the mother. These all statements are from that article. This can help in situations where the mother is resting, is unable to feed the baby, or needs to return to work. It also provides an opportunity for other family members to bond with the baby during the feeding. We can add this as an advantage of top feeding. Again, in an article from Maternal Child Health Journal, year 2016, it said that many parents feel that formula feeding helps their babies sleep through the night at an earlier age, meaning fewer nighttime feeding and more sleep for mother. Again, it is a qualitative and observational study. This is very determining the cost burden. Now, if we see globally, the economic loss from non-breastfeeding is estimated to be greater than 300 million US dollars annually. And if we will see in India, at almost 1 lakh preventable child death and just over 11,000 preventable maternal death occurred each year because of not breastfeeding all the infant and health and young children. And the financial costs in India are 14.5 billion US dollar per annum, including more than 100 million US dollar on treatment for the health conditions such as childhood diarrhea and pneumonia. See the growth rate. Growth rate in the formula market, infant formula market. In year 2021, the infant formula market registered a revenue of this one, 38.17 billion US dollar. And it is anticipated that it will expand with 10% growth rate. And it will reach about 174.66 billion dollars in 2032. Again, the global infant market was valued 45 billion dollars in 2018 and anticipated to surpass 103 billion dollars by 2026. The infant formula comes under two types: the baby formulas, intended for the babies from birth to 12 months of age, and follow-on formula, intended for babies aged over 6 months to until 12 months. There are so many market available infant formulas starting from Aptamil, Similac, Nestle, Lactogen, Farex, and a wide variety of market is there. Formula 1, 2, anti-reflex formula, advanced stage, probiotic formula, constituted with the HMOs and the startup and follower formulas. Now, when we will see the relation of milk formula and infant's gut microbiota, we will find that the infant gut is sterile in the beginning. The newborn gut is sterile, and the gut flora that is established depends upon the initial feed, what initial substance that comes in contact of the gut. And the gut flora exhibits several functions like synthesis of vitamins, amino acids, facilitating the utilization of nutrients, programming the immune system, and modulating the composition of infants' growth. In early weeks of life, there occur in majority the obligatory and the facultative anaerobe exist in the infant gut, and the initial colonization is very critical. The bacterial flora that establishes in the starting period determine the gut health in the adult age. Many cross-sectional and longitudinal studies indicate that the undernutrition in childhood is associated with the immaturity of this gut microbiota, altered diversity, depletion of the anaerobes, enrichment in potentially inflammatory and pathogenic species accompanied by low nutrient utilization. It may be because of the faulty feeding, because of absence of breastfeeding, or because of introduction of other feeding materials other than the breast milk. And because of all these, the dysbiosis occur. The formula feeding has been linked to less stable microbiome across the time. A remarkably different bacterial composition and increased bacterial diversity and richness. In the formula feeders, the count of bacteroids are more, and this dysbiosis has been related to develop necrotizing enterocolitis and very different chronic illness, including inflammatory bowel disease, allergies, obesity, asthma in the later life. Also, the food additives disrupt the gut homeostasis. recent news from year 2021. Vinylin, a drug, a flavoring agent, had been added in the Similac, the Similac infant formula, and the company was charged with the fine because of it. So the food additives disrupt the gut homeostasis. The vitamin D supplementation in the infant formula is also associated with the decreased lactococcus and increased lactobacterium in the gut. Also, the emulsifiers as an additive lower the gut microbial diversities. These alternation in gut microbiota lead to dysbiosis and several type of inflammatory response of gut later in the life. It is also found that the formula feeders has lower level of vitamin metabolism, lipid metabolism, and detoxification. The microbiological processes involved in carbohydrate metabolism were more prevalent, and that's why the chances of developing necrotizing enterocolitis is more in formula feeders premature newborn. The oxidative phosphorylation and synthesis of vitamin B are slow in formula feeders. Talking about the protein used in the milk formula, I told you earlier, it was only cow's milk protein, cow's protein, and the soya that was allowed. And from year 2013, the goat milk is also included. It matches the composition of protein present in the breast milk. And in year 2016, from year 2016, as the standard formula and the follow-on formula can contain the hydrolyzed protein. Hydrolyzed protein are the protein that are prepared from separating the protein from all these sources, and they are more easily digestible, and they are much more used in the cases of the milk allergy. But the problem exists in the palatability. It is very unpalatable and in taste. This is a warning from WHO. Because of all this problem from the formula milk, regular warnings flashed in the news. When you will see the site of WHO, a regular warnings flashes in the site, and this is from the WHO site. The WHO and the United Nations UNICEF hosted the first global congress on the implementation of international code on marketing of breast milk substitute, and it recently held involving 130 countries. It occurred on 2022 June 2023 in Geneva to discuss the strategies to end the unethical marketing of breast milk substitute. Again, this is a news release from Geneva WHO in year 2023, and there is a call to end the exploitive tactics of infant industries for marketing the formula, and an urgent call to clamp down these tactics. And a series of 3 papers were released in the Lancet today, and it showed the industrial influence and lobbying against the vital breastfeeding promotions, and which seriously jeopardizes the health and rights of women and children. Again, it's a news release, year 2022. The report titled Scope and Impact of Digital Marketing Strategies for Promoting Breast Milk Substitute has outlined the digital marketing techniques designed to influence the decision new families make on how to feed their babies. The milk companies, the big industries, through the tools like app, virtual support groups, baby clubs, paid social influencers, promotions, competition, advice forums, and formula milk companies, they are influencing the newly lactating mothers and promoting their brand instead of breastfeeding. Again, it's the baby killer investigation. It is very this investigation is from the middle income countries from 1970s. The World Health Assembly developed the IC marketing breast milk substitute in 1981 and several subsequent resolutions. However, intensive marketing of infant formula continues from that time up to till date. These type of marketing strategies exist that is a very big hindrance in the breastfeeding. WHO, World Health Assembly, Resolution 1996, 2002, again in 2016. These all endorse the policy of exclusive breastfeeding. India enacted the law in IMS Act, Infant Milk Substitute Feeding Bottle Act in 1992, and its Amendment Act in 2003 to work against the strategies of this formula market, to clamp the market, and these are the provision. They ban the promotion and advertisement to the public, the provision of incentive, restrict the donation of products, educational materials like book, stethoscope, etc., and prescribe the guideline for the labeling. None of the infant formulas should be labeled like the infant is growing fast or increase in the height or getting more immunity. This type of guidelines are prescribed. Ensure the accurate information through educational material. Bans promotion and displays in hospital clinics. Prohibit the contribution and benefits to healthcare workers and association, and bans commissions on sale. It is recognized as an offense, punishable offense, and there is a provision of code of criminal procedure for such act. I'll end my lecture with this, discussing this news. It is a very recent news, approximately 15-20 days before, on 26th of July, the Abbott company, the maker of Similac milk formula, was ordered to pay $495 million in baby formula verdict. The company had not given the appropriate message over the box for that milk container that it is the formula is harmful for the premature baby, and because of that, a premature female infant got severe health hazard, and so the company was fined to pay about $500 million. Ending with this slide, the World Breastfeeding Week, aligned with the Sustainable Development Goal of 2030 campaign, and with the hope that we will fill this gap of 44% to 100%, or at least 50% up to 2025, and together we will change the scenario, fill this gap. And all this is all about the pros and cons of breastfeeding. From my side, there exist negligible advantages of top feeding, and there are several advantages of breastfeeding. So taking this key message, take home message, that breastfeeding is best for our infants. Thank you. Thank you for the patient listening. Thank you, Vanan.